Why are tumor markers important for testicular cancer, RPLND? Imagine trying to solve a puzzle where some pieces are hidden. Tumor markers are like clues that help doctors understand what's happening inside the body when dealing with testicular cancer. They are proteins found in the blood that can tell us a lot about the presence and spread of cancer. The main markers used in testicular cancer are alpha-fetoprotein, beta-human chorionic gonadotropin, and lactate dehydrogenase. These markers are produced by certain types of testicular tumors and can be measured through blood tests, giving doctors vital information before and after surgery. Before a retroperitoneal lymph node dissection, or RPLND, measuring these tumor markers helps determine how advanced the cancer is. Elevated levels can suggest that the cancer has spread beyond the testicle, especially to the lymph nodes in the abdomen, which are the primary sites for metastasis. When combined with imaging scans, these markers help confirm whether the lymph nodes are involved, guiding the decision to perform RPLND and shaping the surgical plan. After removing the testicle, doctors look at the tumor marker levels again to help stage the disease, classifying patients into risk groups that influence further treatment options. The levels of tumor markers before surgery also have important prognostic value. If the markers are high before RPLND, it often indicates a higher chance that some cancer remains or that the disease might come back later. Studies show that patients with persistently elevated markers before surgery tend to have a worse outlook, which might mean they need additional treatments like chemotherapy to improve their chances. Tumor markers are also key in deciding who should have RPLND. If markers are elevated, it suggests there is active disease in the lymph nodes, making surgery more likely to be beneficial. For example, in non-seminomatous germ cell tumors, high alpha-fetoprotein or beta-human chorionic gonadotropin levels indicate residual tumor in the lymph nodes that RPLND can remove. On the other hand, if the markers are normal, it might mean the risk of lymph node metastasis is lower, and some patients could potentially avoid surgery, reducing their risk of complications. After the surgery, monitoring tumor markers over time is crucial. If the markers decrease and return to normal, it shows the surgery successfully removed the cancer. But if the markers stay high or start rising again, it could mean some cancer cells are still present or that the cancer has come back. This early warning allows doctors to act quickly with additional treatments or further testing. Tumor markers also work hand in hand with imaging studies. While scans can show enlarged lymph nodes, they don't always confirm if those nodes contain cancer. The biochemical evidence from tumor markers adds another layer of certainty. When combined with the pathological examination of the removed lymph nodes, these markers help refine the staging process, ensuring the treatment plan is as personalized and effective as possible. In summary, tumor markers are essential tools in managing testicular cancer around RPLND. They help determine how far the cancer has spread, predict the risk of relapse, guide surgical decisions, and monitor treatment success. Using these markers alongside imaging and pathology allows doctors to tailor treatments to each patient, improving outcomes and ensuring that the right care is given at the right time. Remember, always consult healthcare professionals for personalized advice, as each case is unique.